We've arrived at the scene. The patient's lying underneath a tree. There's no obstacles around. There's no sharps that we should be aware of that we can see. We're in the correct gear. Feel comfortable about going in? Do you feel alright? Yeah. Okay, so we're going to approach the scene. Yeah, sir. My name's Dane. This is my outside of Sophie with the ambulance. So, hey, alright, I'm good. What's happened?
Fell out of the tree all the way from the top to the bottom.
Okay.
Here I am.
Are you in any pain or anything like that?
Yeah, quite a bit.
Alright. I'm just going to have a look. I can see you bleeding. I'm just going to apply some pressure to that. Sophie, if you could take some vitals, please. That'll be ready to go. Okay. Have you been lying here for long, mate?
Yeah, I've been waiting for you guys for quite a while, actually.
Okay. Quite a while. Okay.
Yeah.
Sorry about that.
I'm just going to rinse the wound. Just give it a quick clean out with saline. And the same with dressing. And I'm just going to apply pressure.
What's your name, sir?
Ollie.
And I'm just going to wrap the dressing like so. Just trying to keep pressure on it. If I want to make it keep pressure with the dressing, I can twist it like so.
Is it okay if I take your blood pressure?
That's okay. What are you doing up the tree, Ollie?
Just trying to get my cat down.
Did you heal it?
Nah.
No. Still up there.
Yeah.
Yeah.
Alright.
Alright.
Gonna learn.
So now I've dressed the wound. Just checking if the cat refill. You've still got good circulation. It hasn't stopped bleeding though, so I'm going to apply another dressing like so. Same thing again, just wrapping around and maintaining that pressure. Are you having an alright day, Ollie?
Well, it's been peachy.
Alright, so now it's completely wrapped. Still good cat refill. If you can keep that elevated, please, that'd be great. Cool. I just want to do a quick trauma sweep, so that's going to involve me just checking the rest of your body, touching you. Is that okay?
That's alright.
Cool. I'm just going to start with your head. So you just tell me if you feel anything.
Ow.
Oh?
Ow.
Ow.
Ow. That hurts.
Sore?
Ow. That
Okay.
hurts.
Is it sore on the outside? Or
Nah,
is it
like down the middle.
there?
Ow. Yep.
There?
Yes.
Okay. Alright, so Sophie, if you could just maintain this headphone, just keep it like that. Cool. And I'm just going to carry on with the rest of the sweep. So I'll start with the arms. Any pain?
Nope.
No blood. Any pain?
Nope.
No. No blood. No blood. Pelvis seems okay. No blood.
Ow. Ow.
Okay.
Ow.
Ollie's indicated that he's got pain in his lower leg.
That hurts.
This sore? Okay. So I'm just going to expose the limb. Also the other one, just to compare. Okay, and I can see the difference straight away that this is a deformity, it's discoloration in the affected limb. Ollie, mate, can you just push against my hands, please? And with the sore leg?
I am
No?
trying.
Okay.
That
Alright.
hurts.
So there's a bit of shortness in the affected leg as well, and he's got no pushing ability. I'm just going to have a quick look at this. It hasn't stopped bleeding, so I'm going to apply a tourniquet. Ollie, this is going to stop the blood pressure going to your hand.
Okay.
It's going to stop the bleeding, hopefully. It's going to hurt, unfortunately. And once I put it on, it can't come off until we get to hospital. Is that okay?
That's fine. I'm really brave.
Okay, cool. Well, we like to put it on a long bone if possible, so I'm going to stick it here. Good man. And we're just going to twist it until we can't feel a pulse. Oh. Like so. Cool. Alright. And we have to make sure that we note the time that it was put on. Okay. Just for your neck, I'm going to apply a C collar. So the way we do this is we measure from the clavicle to the bottom of the jaw, and in all these cases it's 4 fingers, and it's set to the right thing already, right setting. So we're just going to slide this down underneath Ollie's neck. Right, cool. Like so, and put it around this chin. And make sure that it's nice and tight. Complications are that it can increase the intracranial pressure, and it's hard to maintain an airway, like so, and traction on the spine. Cool. Just with the tourniquet, the blood pressure's stopped. There's no circulation, as you can see. Right, Steve, have you got any pain?
Yeah, a lot.
Yeah, right, so I want to give you methoxyflurane. Have you heard of this before?
Nah.
No, okay. Do you have any problems with renal problems?
Nah.
No, so nothing wrong with your kidneys?
Nope.
Alright, have you heard of malignant hyperthermia before?
Never heard of it.
No? Okay, cool. Just going to check the date. Sophie, can you have a look at that too, please?
Yep.
You're going to have to administer this yourself.
Okay.
January 22.
Yep, perfect, cool. I'm just going to put it on your hand here. So you're just going to breathe in and out.
Okay.
And you'll feel that it should take effect pretty quickly.
Okay.
And yeah, cool. I'm just going to splint your leg now. Have a suck on that. Alright, so if we can splint his leg, I'm just going to check the kit refill. So he's got a good perfusion to the limb. Can you feel me touching your foot?
A little bit.
Okay, so that's good too.
How's that pain relief going?
That's much better now.
Awesome. Alright, so I'm just going to lift the limb and try and keep it as stable as I can while Sophie slides the splint underneath. Alright, Steve?
Yeah.
Cool. Alright, so keep it there. Try and keep the foot in a plantar position. I'm going to lift that, and so if you can, yeah, slide this underneath as well. Cool. One, and we'll just do this while we're there too. Cool. Alright. So I'm just going to tie it above and below, nice and tightly, above the wound. Like so. Alright, Steve?
Yeah.
Yep, good. Alright, just check for cat refill again. Yep, and you still got good perfusion. And can you feel me touching your hand? Yep, great. Cool. Go. Alright, so now that John's leg's been
Different name every time.
okay, so we've just splinted the patient's leg. It's been about 10 minutes since we last did the vitals, so I'm going to check them again. I'm just going to take your blood pressure. Alright?
That's fine.
Cool. Yeah. Take your arm again. Cheers. Feeling alright?
I'm tired.
Yeah. Okay. Okay, so although your blood pressure's a bit low, it's 80 over 50, so it's out of the usual range of 90 to 100 for systolic, 120 sorry, and 60 to 80 for the diastolic. I'm just going to check your heart rate.
Okay.
Alright, so, and I do this by counting the amount of beats there are in 15 seconds. I'm not going to tell the patient, but at the same time I'm looking at his chest rise. I'm going to count his respiratory rate as well. Okay, so Ollie's heart rate is 110, which is sort of out of the normal range of 60 to 100, and his respiratory rate was 24, which is out of the range as well. It was 12 to 20. So could you please test oxygen, Sophie, 2 litres per minute through nasal songs? Ollie just keeps moving on smoking that. And I'm just going to have a wee listen to your lungs, if that's okay.
That's fine.
Cool. I'm just going to go underneath your shirt. So I guess you listen to the left lung. Big deep breath in and out slowly. And again. Alright. And again. Okay, cool. So there's no wheezes or crackles or anything like that, so I'm confident that his lungs haven't been disrupted. At this stage, I think Ollie, are you comfortable enough to go into the ambulance?
Oh yeah.
Yeah, and we'll transport him to hospital. He's cold, so we're going to make sure that we keep him warm, as he could be going into hypovolemic shock.